On this week's edition of Earthfile, we'll bring you a report on the second National Healthcare Waste Summit in Lagos, Southwest Nigeria. The theme for this year's summit is Healthcare Waste Management and the Environment. The summit brought together environmentalists, safety experts, medical practitioners, healthcare waste managers, government agencies and representatives from other states, as well as members of the academia and students. They were invited by the Lagos State Waste Management Authority, LOMA, to learn the importance of managing healthcare waste in relation to the environment. Last month, the federal government approved the National Policy on Healthcare Waste Management, which will ensure that medical waste is handled and disposed properly.
The focus primarily among everybody was all about the domestic waste, the waste we see on the streets alone. But LOMA was able to stratify this waste in line with the various components of the stream. And we found out that various components of that waste as emerging waste that are actually common. And on our emerging waste list, we had the healthcare waste as the number one waste there, because we knew quite well that we had to give it the special attention it deserved.
Then came the art of educating through formal speech.
The major landmark in history of healthcare waste management was made this year when the Federal Ministry of Environment launched the national policy on healthcare waste management. This giant stride is a plus in our nation in general and is putting us on the right track.
We talk about poor medical waste management in developing countries. A lot of infections have been reported. HIV was reported in the United States as far back as the 1980s, and also in South Africa as well, in children after playing illegally dumped medical waste. We have increasing frequency of enteric fevers, cholera, some recently reported in Jos, infectious hepatitis, and AIDS. This, of course, may not be unrelated to disposal of medical waste.
As the summit ends, we sought the opinion of experts on some of these issues.
Well, for me as a practitioner in healthcare waste management, I think one of the greatest things that has ever happened is the fake endorsement of the national policy on waste management. I felt great, and I think I was very happy that day, and I felt vindicated. I felt so happy that the struggle that we started 7 years, 8 years ago is now yielding fruits. Right? If it has taken us 7 years to get it signed, I think we're happy for it. And when you look at it, it's an instrument, it's a regulatory instrument that will be used at the national level to regulate and replicate what Lagos has done so far. There are various components of that document that we use the Lagos baselines data to develop. So because Lagos started, and Lagos, we decided to develop, to be the baseline and to develop data that can be used. So what we have there right now is so good, and it's going to help us to make sure that the disease control will be a national thing. Most of the disease spreading all over, we still see many people having AIDS. I mean, you see little children who have never grown to the age of having sex, having AIDS in them. How did he get it? He got it from careless disposal of syringes of AIDS-infected people. You have a lot of people who are diabetics who are using syringes, and they use them and they throw them in the dustbin. So all these cases are going to be treated, and we're going to tackle it. And the national policy is always letting us know that pedicure waste is also medical waste. So there are ways you treat the pedicure waste. There are ways the barbers will use the clipper. You finish using a blade for somebody else, and another you are using the same blade for somebody. So it's really going to help in disease controls, and I make sure that the budget the government is spending on curative health will reduce if we now spend more time in preventive health programs. So it's an instrument to enhance the preventive health program at the national level, and I'm sure it's going to be for the national benefit. The blueprint on the national policy is a statement of intention. It's an expression of values. At the national level, these are values. This is what we believe in when it comes to healthcare waste program. Talking about sanctions, yes, each state government at a national level to have to legislate based on that national policy. you now legislate on the various sanctions that you now want for people who will err from it. So it's a guide. It's a guide for all the states in Nigeria to follow suit and say that, look, this is a national vote. This is what the federal government believes. This is what we as the people of Nigeria, this is what we believe in when it comes to healthcare waste program. And for every state of Nigeria, you now have to use that instrument to now legislate and make sure that you control and you apply sanctions for those who erred from that national policy. It's an expression of interest, and that expression is very, very key and very strong. Well, we look at Lagos, for example, to practice for the healthcare waste program. As a practitioner, you have to be duly registered. You have to be really tutored in medical care. You have to have a good understanding about the healthcare program. So you're not ignorant of medical sciences. You have a basic understanding of medical sciences. So that way you all have the understanding of the potency of some of these products from the hospitals. So for those who are managing waste in Lagos, especially the healthcare waste program, they're well tutored in that regard. And you have a specialized van, usually double-coated vans, and you have specialized containers, and Loma distributes color-coded bags for hospitals where these wastes are separated. Even blood and syringes, tissues, sharps, they are collected and are disposed of. Now, the key issue there with the environment is that if you're not careful, all right, and you dispose of this waste carelessly, the impact on the environment, it's very, very dangerous. And it may not be a global thing, but locally where you are, you have a various impact. And if you dump it on the landfill sites, it can decay and pollute the underground water around you, and it transmits, and other people will pick it up, and you have a case of cholera and the rest of it right now. Now, even if you don't do that, there are some hospitals that they burn this waste. They just go behind the hospitals and they burn this waste. By the time you are burning syringes and tissues, you are releasing furans and dioxins. And this component, they travel beyond the immediate environment, your immediate area where this crime is being committed. So whatever I'm doing here, right now, can have an adverse impact 10, 20 kilometers away. And the component of healthcare waste, the concentration of this dangerous material is very, very high in them. So you don't want a situation where we now start dispersing this product. You have people who build incinerators, they have mass burners, they call them incinerators at their hospitals, and they don't have a complete burning, complete incineration of this waste. And they decay the environment. So these are key issues. Now, Lagos, yes, we've been able to curtail this in Lagos, but there are other areas in the nation where you still see hospitals burning this waste. All right, and if you have neighboring state to Lagos, and if this thing is going on there, Lagos is not safe, and nobody is safe. If people are still handling waste management ignorantly, nobody is safe. If people are still building incinerators and they're burning them at a lower temperature and they cannot control the flue gases, the gas will be emitted and the adverse impact can cross borders. So nobody is safe if we are not doing it well. You don't know, we have a lot of sicknesses these days. You have a lot of cancer-related cases where you cannot trace it. People who have the best of personal hygiene will tell you they have cancer. They pick this thing in the air. Most of the problem of the healthcare problem is airborne. It's airborne. And we really want to curtail this and make sure that everybody live in very good health, and the state of the health of everybody in Lagos is assured. That's why we have to keep on with this awareness campaign to make sure that it's not just Lagos that will be safe. Nationally, we can impact positively on the well-being of people by doing the right thing.
All health facilities are expected to dispose their medical waste appropriately and through the proper agent. Just of recent, we had information that some health facilities were not disposing their healthcare waste adequately and properly, and that they were just dumping them by the roadsides, and children during vacation would have a free day, scavenging through those bags. We set out our team, and we got a lot of healthcare facilities that were actually not properly disposing their healthcare wastes. The agency does not joke with this kind of infraction. When we got this information and we went out, about 3 hospitals that were found commingling their wastes, not adequately disposing of their wastes, that had no evidence of a relationship with Loma, were shut down.
Safety and environment. Sometimes we call it HSC, sometimes we call it SHE, which is